All right, guys, welcome back. Question the answer. I'm Christine.
I'm Megan.
And today we are storytelling because we have a lot of
Uplifting
stories.
too.
Not really. I mean, we're going to talk about healthcare today, and not in the way of bashing healthcare workers, because that's not our intention.
No.
Our intention is to kind of bitch and moan about the healthcare process.
Yes.
Which I just went through an episode with my mother, and I was watching the processes. It's not the people that were bothering me. It was the process the people were executing.
And I don't know. I feel like, or maybe it's just because we're getting older and you're going through things yourself now. But I feel like years ago, basically pre-pandemic,
Years
ago now, I don't know, were the processes as bad, or did the pandemic shed light and bring to light some of the issues that have always been there?
Well, I think it did that. Plus, I think it also brought a new problem on.
Wow.
With staffing.
Yes.
Now, if you work in today's day and age after COVID, you understand the words labor shortage, because every company, every industry, every business has a labor shortage.
Everywhere.
I don't know where all these workers went. I mean, I know I read an article the other day that if you live in New Jersey, a 2-adult household income on unemployment is $160,000. Yeah. It's actually more beneficial for you to sit on your ass.
Then there's your answer.
But that's New Jersey. And there's not, here in New York State, I believe you can only make up to 25 to 30 grand a year. So you can't live off of that.
Can't live off of that, yeah.
You have to work. But I don't know. So once again, if you're working in any industry, you understand there's a labor shortage because you're probably doing double duty yourself. But the problem, I think, happened in the healthcare industry, and it blew up and exacerbated the problems that were already existing.
Yeah. Well, here's the thing, too. When you have a labor shortage, and this is in any industry, your quality and level of care or level of work and, like I said, quality, that diminishes because you don't have the adequate amount of people or whatever behind what you should be doing to get it done right. And especially in healthcare, like you can see it all over the place in hospitals. The quality of care, it just isn't there anymore. And again, it's not against the nurses and doctors, because I can't even imagine being a nurse, being a doctor, or anybody in the healthcare industry that had to deal with what we went through for the past however many years now. I really can't. And I know they're trying to do their best. But when you don't have enough bodies and hands, how are you supposed to?
Well, one person can only do so
Right.
much work, but we'll get to that in a second, because then I'm also, once again, the process of these 3 people have been sitting on a computer for the past 3 hours. Anyway.
Right. Yep.
We'll get to that in a second. But like, I pulled up an article. This is from Forbes. The healthcare industry is crumbling due to staffing shortages.
Mm-hmm.
I mean, so once again, the healthcare industry wasn't immune to what was going on during COVID, which was everybody went home, or they were forced to do something or sacrifice their job.
Mm-hmm.
So, that affected things. In a study done earlier this year, the U.S. Bureau of Labor Statistics reported that more than 275,000 additional nurses are needed between 2020 and 2030. Employment opportunities for nurses are projected to grow at a faster rate than all other occupations.
I believe it. And I feel like I've noticed a lot more of these, I think they're calling them like traveling nurses.
Oh, I have a story about that one.
I think that's why those are becoming so popular too, because there's such a shortage. So if you have somebody that can kind of bounce from place to place, why not? And I'm sure they get paid pretty well.
Well, I met 2 out of 3 of my mother's nurses were traveling nurses. Mm-hmm. And
in the area, or did they go all over?
So she was from not Albion, somewhere down there.
Okay.
Sounds like Albion.
Melbian.
Rhymes with Albion. So, and I don't know where the other one was from, but she was she wasn't as, I wouldn't say friendly, but she wasn't as talkative. She was a little shy. But 2 out of the 3 nurses on one day were traveling nurses. Now, I know they get paid a lot more to do that. But once again, you're kind of sacrificing your
personal life.
I mean, one of them had children, and she's like, I just don't see them for like a whole week. And I'm like, oh my God. And there were also 22 traveling nurses that were hired on the day of my mother's discharge.
Oh.
Because I asked, I said, is anybody like it's going to take years to get you guys up to staff? Because I was kind of nailing them down and saying, well, how many people are you understaffed? You know, like when I worked at the animal shelter, we were always like 7 to 9 people understaffed. So we always knew the number because they would bring in like a third party to do that. She had no idea. She had no idea. Not that I'd expect her to have an idea. So, So, for example, the norm for a standard ICU nurse may be to manage 2 patients over the course of a shift. Shortages now demand that they manage 3 to 4 patients, paving the way for less than ideal care, which is what you were alluding to earlier.
Yes, and it happened. I will get in this. I have some things on this for later, but go to the nursing homes. There are shortages there as well. And especially during the pandemic, the quality of care for the individuals in those nursing homes were horrendous. So we'll get to that.
I mean, it takes a saint to work in a nursing home.
It takes a saint.
It takes a saint, and there's not a lot left. So let's actually, I'm kind of curious what your story is.
Oh.
Well, like you do a story, I'll do a story, then you do a story.
So my own personal experience was back in 2020. So we're in COVID. And
what month in 2020? March. Oh my God. So it just hit.
Yes.
Okay.
So the whole thing was strange. You know, it's nerve-wracking because this was a spinal fusion surgery for me. So it's a big.
Now, why did you need this surgery? What happened to you?
Well, it was my lower back. So I was bone on bone. There was no disc left. And then.
Were you born like that, or was that?
No,
did it just?
I don't think
degrade?
So. I think it just degraded over time. And he said sometimes you can be born with maybe a little bit of that, but then sports, pregnancies, like things add to it.
What was it, like the L4, L5?
It was, yes.
So I'm going to tell you right now, in our family, that's hereditary. Grandma had the same thing.
Thanks.
I have it. My dad had it. Not that you're linked to my dad in any way, shape, or form, but Grandma definitely had it.
Yeah, it was brutal. I mean, it was bone on bone, and then one was slipped forward. And then my S1, it was cracked.
You know what S stands for? Your sacrum.
Sacrum. Mm-hmm. It was cracked. Don't know how, but it was. So,
because you were always complaining about lower back, and you were debilitated by it, yet you still managed to pick your kids up.
Yeah, I mean, you just do what you got to do, I guess. But it got it was always a pain, but then over time, it got to the point where it was so bad I could barely get out of bed in the morning. I had to roll my whole body off the bed and lift my legs up. And it just got so bad that I was like, yeah, I feel like I should maybe be seen. This isn't normal. So finally got the surgery scheduled. And
did you have to do an MRI?
Yeah. But thankfully I didn't have to have my head all the way in.
Really?
Yes, because it was my lower back. So whatever contraption they put me in, it was just above. I'm talking.
That's right. So I asked if I could go in feet first for my lower back, and I tipped my head so I could see a little bit of light.
A sliver of light.
Yeah. Okay. Okay. Sorry.
But it was. I mean, my parents had both had them in the past, and I just remember they both they can't. Have a hard time with the MRIs.
It's a tiny little
they freak me out.
So let me ask you this question, a little side note. I have a friend who thinks an MRI is like a tanning bed.
In what way?
That's what I said. It's not like a tanning bed at all.
Because I didn't have music playing. I wasn't relaxed.
Oh, they're supposed to play music for you.
All I heard was that's all I heard in mine.
My favorite thing is there's a going in the background because it gives air to the machine or something. Do you remember that?
Yeah. I mean, there was all sorts of pounding. And then I must have I must have moved a little bit.
Mm.
And she's
start over.
We got to start over now. And I was like, damn, are you kidding me? So I had to just sit there. And then now you're thinking about not moving, which makes you want to move.
Right.
So it was, oh my God, it was a little brutal.
Thinking about moving. So I wanted. So
yeah. So now I'm like, don't move. And then I'm like, did I just move? In my head, I'm like, oh my God, I'm moving.
Well, you're even afraid to breathe. You're like.
Yes. But if I had to, at least, like I said, I had a little opening, but if I didn't, that would probably freak me out. And I'm normally not too bad with stuff like that. But.
Okay, so the worst part, if you've never had an MRI before, they lay you down. It doesn't look so bad when you walk into it.
No, it does not.
They lay you down. They give you like this little pillow. They put headphones on you because the sound that you're talking about is the weights that turn over in the machine to get the images. Because what they're doing is building a 3D image of your body. Yep. It's one of the most informative pictures they can take of you internally.
Oh, sure, yeah.
And so you lay down on the bed, and it doesn't look so bad. But then what happens is they start to raise you up. And you're looking at your feet, and that hole becomes smaller and smaller. And I know every time I've gone into one, I've had 4, I feel like I'm going to slam my face on the top because you're up so high.
You're so close.
And you get like this little half moon of space that they slide you in. So it's
like you're being buried alive, kind of.
It's not that bad. Oh my God, it's not that bad. You're not being buried alive.
A little bit.
But if you open your eyes in the MRI machine, it's right there. So I don't think it's like a tanning bed at all.
No.
And you don't come out glowing.
Yeah, and you're not like refreshed after by any means.
Refreshed.
You're just sweating and panicking. Yeah, so we had that. He had the surgery scheduled, and it was weird because Pat, my husband, had to just drop me off at the entrance.
And
it was just like I was going off to, I don't know. I was like, see ya. Like, hopefully.
And by the way, it's harder on the patient that has to like sit in the parking lot.
Oh, he was like freaking out about it. I was just like, at least I'm going in to do it, you know?
Well, you're like, I'm going to get knocked out in a set. Like, I'm going to get sedated. Like,
but then there was delay. Like, my surgery got pushed back. So I was just waiting in this room, watching Bravo for a while. And it was hard. Like, my parents kept checking in, past checking in, like, are you going in for surgery yet? And the day just took a long time.
Did your doctor come in and have you sign this like very strange consent form?
I think so. I can't really remember.
Really? That's like, I find it the most bizarre part of the process.
Like, you might not wake up.
Your doctor, before every procedure, even before I do my epidurals, and for the surgery coming up, you sit in that room and you wait. Yeah. And then I guess when it's your turn, the doctor comes and they give you this like consent
He
form.
must have. I probably just blanked it.
And it's like one of those commercials where it's like, you could go blind, you could go unconscious, you could never wake up, your feet could fall off. Like, and it's like all these things
and you're like,
assigned to.
Okay.
And then they send the anesthesiologist right in. All right, knock her out. That's right.
Yeah. So, it's just it was a strange feeling of not being able to at least have one person be with you for that inside.
When you need it the most.
When you need it, because you're going to be, it's a big surgery.
You need to be distracted. Yeah.
So he drops me off. Eventually the surgery happened, and then you wake up, and he was able to come, obviously when I was up, but because my surgery got pushed back, the visiting hours were ending like shortly after I had come into my room, my shared room. And, which was a whole nother experience. And he had stayed past visiting hours because he's like, well, I just got in here. They lost my bag. We found it. But I'm like, what do you mean you lost my bag? I put it in one room. How do you lose a bag? This isn't an airport. I didn't fly here. And I was like, when you wait, I was like kind of disoriented. I was like, what do you mean you don't have my bag? Where's my bag?
Oh,
like,
I'd be pissed.
I was freaking out kind of.
I'd be pissed.
So Pat's like, I'm not because they were trying to get him, telling him that visiting hours were over. And he's like, I'm not leaving here until you find the bag that she put in the one room that you told her to leave it in.
I'm not going to leave her here. I'm not going to leave her until I find out she's okay.
But again, it was like there was no sense of urgency. Literally one nurse was like, oh, this happens all the time. And we were like, it happens all the time? It's just that lack of like empathy kind of. So we got the bag. He left. I'm on my own. I'm in a crap ton of pain. I had this woman next to me. There was a curtain. Elderly woman going through things over there. And so, and I feel terrible because she's by herself too. And the overnight care was pretty brutal, I will say.
So wait a minute. You get the surgery. Let me ask you a question. Did you do general or did they do Twilight for you? General.
Twilight.
Okay. Twilight is this new thing they do where they give you pain nerve blocks and they sedate you a little bit. It's kind of like a colonoscopy where you still wake up like and you can still function after. General anesthesia is where they
I had anesthesia.
Stick the tube down the throat. You would know because you have a sore throat. I had one surgery where I woke up with the tube still in my throat and I had to rip it out when I woke up. That was my second knee surgery. I got so pissed at the nurses. I'm like, you're supposed to be watching me. It's your job to, and this was not COVID. So this was decades ago.
Oh, it's like when my dad they didn't give him enough anesthesia and
oh my God.
And long story short, lost his front tooth.
They chipped
Remember that? Remember that one Thanksgiving he had?
No, I don't. We'll get to that in a second.
That was
That's why
years
I wanted
ago.
him on. He's got stories.
He's got lots.
Our family we don't have a lot of health issues. We just have a lot of little things.
And there's enough of us that's like, it seems like a lot.
True. Maybe that's it.
So
it's quantity.
It's quantity for
Quantity
sure.
at this point.
But yeah, he could probably write a book.
Okay, so you wake up from your surgery.
Wake up with a missing bag. We get the bag.
Did you wake up just screaming for your bag?
I was just like, how do you lose a freaking bag? In a hospital that I've only been here. So you moved me down the hall. I don't understand.
You know what's interesting? In my instructions, it says have your bag stay with your support person. And when you get admitted into that room that you're talking, then they bring it in.
See? If I had a support person, I would never have a missing bag. So nighttime comes and I'm coming out of a major surgery. I can't move. I literally can't walk. And I was supposed to get pain meds every, 4 hours or so.
Usually every 2 to 4, yeah.
Yeah. So that time, I think they gave me my my next dose. But then there was a time overnight where I was due and no one came. So I'm like, and when you're due, you're due.
No.
Okay. So I was like, and I'm trying to sleep and it like woke me up out of a sleep. I was like, oh my God, I need this medicine.
But I bet they're there for those stupid vitals every hour.
Oh, they sure were. But I'm ringing the nurse bell and I'm like, I'm due for my next dose of medication. Okay, yep, we'll be right there. 20 minutes goes by, 30 minutes goes by, and I'm an hour. I went hours without getting my next dose. And I remember I was laying on my side and I was like clutching the hospital bed rails and I was like, just deal with it. Like, you'll be fine. Like, because no one was coming. And then they finally did. And I was like, I've been buzzing this thing. And the poor woman next to me is having all sorts of issues. And she's left there. Like, it was bad. You could hear they were short-staffed is what I was told. There was all sorts of issues going on the floor. Like, they were needed elsewhere. And I'm like, okay, I understand that. But you have to take care of every patient. Every patient.
Well, you can't not administer pain medication after a major back surgery.
No. It just sets you back, if anything.
Well, that's the problem. See, the thing when you have surgery, if you don't want to be a tough guy and tough it out.
You don't want to play catch up.
You have to stay on top of the pain, or else you'll never catch up to it until you start to heal, which is a few days after that.
And then, Pat, he was in. I don't know if it was that same day of my surgery or the next day.
He had to be going crazy.
He was visiting. Maybe it was when I got out of surgery. Anyway, they put those compression things on your leg.
Yeah.
And the lady said something like, they never turned them on. They weren't turned on. And he was like, are you going to turn those on? And she was like, oh, yeah. Like, stuff like that. And then the next morning, it was super early in the morning, got me up to go to the restroom. And I've never had a major surgery like that. So I'm just going along with the lady that's walking me to the bathroom. And she just put me in there by myself. And that's when I fainted. That's when I passed out in there. And
wait a minute, you fell
in the
after
bathroom.
Back surgery?
Yes. Because no one was assisting me. But I didn't know that they should have been in there with me either.
Let me ask you a question. Before you fell, how long before that did you get your pain meds?
It's a good question. Not long. I mean,
that's what I'm saying. Like, someone who gives you pain meds can't let you do anything. It's like, duh.
Yeah. And my blood, I was having like my blood pressure when, I forget what they called it. So basically when you sit up after being laid down, my blood pressure would drop.
Yeah. And
I was having issues with that. But yeah, they heard a thud because I was in there and I was at the sink and I remember just being like, don't do it. And then I just kind of like fell backwards. And thankfully I had the brace on.
I'm laughing now because you're okay.
I'm okay. Yes, we can laugh. But I literally out loud was like, don't do it. Like, don't do it. I was looking at myself in the mirror. And then I fell like straight back. And thankfully I had the back brace on because I had to like wear that at all times.
My
and
God.
The nurse is like, are you okay in there? And I'm like, my back's like against the wall. And I was like, no. And so like then then not everyone shows up, right?
Oh,
All the shortage.
Code red.
Now all of a sudden there's 1,000 nurses on the floor and they're all pulling me back into the bed. I'm getting a cloth on my head and and I'm just like, okay.
Did they give you another x-ray after that? I'm sure they had to go get more imaging.
I did have to get imaging.
Jesus.
But I was already scheduled for imaging. When my dad, Pat too, freaking out. Pat, I think, called my dad to tell him I had fallen.
I would. Oh, yeah.
And my dad went Liam Neeson on.
Oh, my God. That's ridiculous.
Yeah, so I was thrilled to get out of there. I couldn't wait to get out of there. I felt terrible for the woman. Because, for the most part, thankfully, I'm younger. I'm in good health and can be okay. But, like, I was thinking about the woman next to me who was elderly, can't speak for herself. She could barely put a sentence together. She's struggling. It's like, who's there helping her? I understand we were in the middle of this. We didn't know really at the time what was going on. We were just told to like shut down everything, whatever.
Yeah, you were right in the thick of it too.
Yes. And, I get that. But then at the same time, like you also have to just have human decency for people that are in vulnerable situations.
Well, here's my thought. Here's how my brain kind of breaks this down. Listen, COVID affected every industry, not just healthcare. Yep. My own company, for example, we were shut down. We had to get creative and find ways to do things with less people and do it differently than face-to-face contact. So my question is, why is all of the other industries that aren't ran by the government in some way, shape, or form, maybe not even government, but like federally, I don't know if a hospital's federal, anyway, why didn't people get into a room and be like, okay, we have one nurse for 4 patients. How do we make this work? And how are we going to it's kind of like they just were like, oh, we just don't have enough people today. So just do what you can. That's kind of the feeling I got. Just do what you can.
Yeah.
It's just finish what you can. It wasn't like, let's all sit in a room and figure out how to be more efficient and how to do less.
Because it's not going to cut it to then have to tell the patient or the patient's families like, we're just short-staffed. Like that doesn't work. You can't, It doesn't work anymore.
No, not when you're
It actually never was an acceptable excuse, but I feel like even now, today, you shouldn't be even saying those words. We get it. But you're talking about hospitals. You're talking about people that are there because they are in need of something.
Yeah, it's life or death or, quality of life.
It's just like, and now I will say, so my oldest daughter, we've had, unfortunately we had to spend some time in the hospital with her and she recently had a procedure. Now on the children's level.
Oh, I bet.
They have been great.
Good.
But it should be for everybody.
You're the second person that I've heard in the past month that is like the children care is phenomenal.
As it should be, but and you expect that, to be honest. But yeah, they were wonderful. Now I will say when we were there for her surgery, she should have been put in a room, like her own room, but there was a bed shortage because of all the respiratory illnesses that are now going on, and I wonder why. But so we did have a room and it was curtained and it was just us in there. So it was fine, but we only had to stay one night. So that was okay. But again, there's bed shortages. We're trying to get you a room, but you might have to stay in this room. And we're like, whatever, that's fine. But again, it's just like, what's going on?
No one is coming.
But the nurses and the doctor, like they were wonderful and they were great. They know how to be with the kids and make them feel comfortable and all that. So
that's good to hear because I just had an awful experience with my
So share your story.
With my mama, who by the way never complains about anything. Yeah. She's a very strong woman. I live with her, and we're buds. So my sister texts me. She goes, Mom left Trevor's game really early. Can you check on her? So I get home and she is in massive amounts of pain in her upper right abdomen. And she's gotten sick. And I was like, Mom, from my experience that you need to get into the hospital immediately. Now, listen, when I went in for my right-sided diverticulitis, I only had one hiccup about that care. So I got right into emergency. They thought I was having an appendicitis. They got me right into imaging and they got me right into a room and they pumped me full of antibiotics because I hadn't perforated. My only hiccup was the doctor. who was I never met. Once again, you go into emergency, you get all these things done. You have all these people
Right.
looking at your charts, but you never meet. They're like the Great Oz.
And
like,
they all ask you the same question.
yeah.
The same questions. And you're like, can you just record, like type it? And then the next person can just literally read it because they're going to ask me the same thing.
Mm-hmm. Yeah. But that's okay. But no, I'm there for 2 full days. The infection is resolving. It's not an appendicitis. It's diverticulitis, which is very rare on the right side in Western civilization, but actually it's very common in the Asian civilizations.
Oh.
I don't know why I'm saying civilizations.
In our civilization.
In the Asian countries. I don't know. So
I didn't know that.
I have an extra little tubie. Once again, just a tiny little deformity in my body that caused an issue. Got infected.
Special.
And the only problem, there was everything was fantastic. The nurses, the care, this was prior to COVID. One thing irked me about this whole experience. They literally just give me my dose of Dilaudid.
Mm.
And have you ever taken it?
Mm-hmm.
And you are just like, woo.
Bye-bye.
Yep, you are not present. Let's just say that. The doctor walks in. Literally, the nurse walks out, high fives the doctor walks in, who, by the way, has a very heavy accent.
Mm-hmm.
And I remember I'm kind of like, I'm laying there because I'm feeling good. And I'm like, yeah. And she comes up really close to me and she goes, hello, Christina, I am blah, 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 blah. Just so you know this, and all I hear is cancer.
What?
And I go, what?
Oh my God.
And I start bawling. My parents walk in from the cafeteria.
Oh, I think you told me this.
And they go, what did you say to her? What did you do to her? Because I'm bawling. And I'm like, I have cancer. And the doctor was like, I heard her say, no, I didn't say that. And she starts talking to my parents. And once again, when you just get hit with that Dilaudid.
Yeah, you're not comprehending anything.
No, I didn't know.
You thought you had cancer. I mean,
I was in like Puff the Magic Dragon land of Hanali. I mean, totally. So she cleared it up with my parents. And my parents came back over and was like, listen, she didn't say you had cancer. She just said, this could be caused by, or it could be this, or it could be that.
Yeah, but why is she even telling you that?
And, finally when I kind of snapped out of it, I was like, and my dad, who's very similar to her, he's like, why the hell would she do that to a young girl?
Why?
Who just got her pain meds. So that was the one issue I had.
But that's what I mean. It's like bedside manner. I guess.
Is that bedside manner?
I don't know.
Is that just like, I don't know, in
Common
the world
sense?
of duh, like don't open up with the word cancer. I don't know.
Like ever. Yeah.
So we bring my mom in. She does go back right away, but she goes right into the hallway. So we don't even get a room in emergency. And we're not only are we in the hallway, we're in the entrance
Of the ER?
of the ER,
Which
where everybody comes in. And
it's quite a area to be in.
yeah. And straight down that way is where trauma comes in. So we can see all trauma coming in. Which, P.S., if you ever want to get into the ER and seen immediately, call an ambulance. That's how you get in. That's grandma's trick, by the way. My mom kept saying, I should have called an ambulance. I should have called an ambulance.
Yeah, I bet, because you're being
So now
transported.
2 to 3 hours goes by and only one person's allowed back. So me and my sister are kind of like doing shifts at this point. And she says to me, she goes, what if I get sick? And I go, are you going to get sick? So I go, nurse, what if she gets sick? So the nurse is like, I'll get you something. And I look at my mom and she goes, no, I need a bathroom. She goes to the bathroom. She comes back, literally like, well, it's gone. I'm fine. I'm in no pain. It's gone. I swear. I'm like, shut up. I'm like,
You're
stop.
like, sit down, please.
I'm like, act sick because you
don't want to be turned away. Yeah, you've already been there.
I'm like, you're already going down to the list. They've already heard you. They've taken your blood at this point. And she finally sits down. But once again, you're just waiting and waiting. And I'm watching everybody else get taken care of around me except my mother, who, by the way, still has pain.
Yeah.
But she wants to leave so bad.
But why were they taking other people over your mom?
I mean, we have a sprained ankle over there.
I thought you signed, but it's the order of how you come in.
No,
Depends,
it's triage is the order of like, please know the purpose of an ER is to save your life. If you are not in something life-threatening, I understand you're going to have to wait. Trust me, I understand that. But the things that we're getting taken care of around me were also not life-threatening in any way, shape, or form. So now I'm slowly losing it. I'm losing it. I am losing it. It's like, no, 7 hours, 8 hours,
No.
9 hours, 10 hours.
And you're in the hallway
And
still.
I've almost killed every nurse.
You're in the hallway still?
In the hallway.
No.
And by the way, I don't have my mask on at this point. Like, I'm like, I don't even care anymore. Like, there's no way I'm sitting here with a damn mask on that, by the way, does nothing. And we've proven that it does nothing.
Well, we just need to pretend that it does.
And I'm watching through these hours through, and this is night. This is at night. This isn't like we're like 8 hours during the day. This is all night. And I'm watching 2 doctors run around with chickens like they're, I mean, these doctors, there was one really cute doctor too. He was amazing. Once again, I think there was like 116 patients in ER.
My God.
So then I grab another nurse and I walked up to her. I said, hey, can I ask you a question? And listen, I'm not that fun to deal with when I'm upset. I get that. But I said, can I ask you a question? She goes, what? I go, is it normal to wait 9 hours to get blood results back? And you know what she said to me? She goes, well, we only have like one doctor working.
That was what she said?
I go, that's not my problem. Is it normal to wait this long to understand blood results? She looks at me, she goes, yeah, well, there's like cardiac arrest happening. You think we're not going to take care of them first?
Oh.
I looked at her, I got so close to her, and I go, never mind. And my mom was like, Christine, you need to come sit down, like, because I'm just like pacing at this point.
Because that's frustrating.
Listen, you can deliver the same information in a very different way and not be freaking callous about it to someone who's sitting there. Do you think we want to be there? Do you think if there was any other option in the world, we would go exercise that option? Of course we would. And then there's this little old woman who keeps saying, I need help. And nurse after nurse just walks by her. One nurse comes up and says, oh, I'll get you help, leaves. 30 minutes goes by, I need help.
Was she there by herself?
Yeah, all she had to do was go to the bathroom.
Come on.
There was one funny woman. So my mom, once again, gets up and walks around, and I'm just like, I get you're not life-threatening right now, but like, can you please just sit down? She comes back and she's laughing. And I go, Mom, what's so funny? She goes, that woman over there. She goes, I walked by her, a little old lady in the hallway as well. I guess grabs my mom and goes, did you get him? And my mom goes, well, yeah, I got him. And the woman goes, did you kill him? What? My mom goes, no, I didn't kill him. She goes, well, I don't get it. I kill the animals. Why can't you kill the animals? My mom goes, I don't kill anything. She goes, I want him killed.
I want to be where you are right now, lady.
So I go, I got to go walk by this. I need some type of comic relief right now. So I go and I walk around. And it's the little old woman that's hanging off, because I'd seen her because I'd done 15 laps at this point. She's hanging off the side of her bed. And I think there's obviously something mentally. Like... And she grabs me, because she's probably been there as long as we have at this point.
Maybe she's just trying to entertain herself. She's like, I'm going to see who responds.
She grabs me. She goes, who's that woman? Who's that third woman in that room? I go, I don't know. I go, why? She goes, I don't like her. I go, I think she's okay. She could stay. I want her out.
Oh my God.
And at that point, I was like, I'm just going to walk away. Then there was Herman. Herman was another guy that entertained
what
us.
do you guys...
Herman was having an anxiety attack, and he's this old man, and he's calling his girlfriend Barbara, wake Nathaniel up. I need my anti-anxiety meds. So finally we go up to the room, and once again, we don't see a doctor, and we wait. And she has a private room, which is better. And the nurses, it's like a different type of nurse upstairs than it is down. And they even admitted to that. Because I asked, I go, is it a different breed of nurse downstairs? She goes, oh, yes. It takes...
And I think it's the same case for the nurses that are overnight.
Mm-hmm.
At least from what I saw.
Well, my mom said the overnight staff was fantastic.
Oh, well, that's good.
I'm like, Mom, the person that comes on and takes your blood pressure, is that who you're talking about? Because they don't really hand out pain meds anymore.
Is it because there's a shortage on everything, isn't there?
No, it's because they got everyone addicted to opioids. That's the problem. They can't just hand it out like candy. So you have to be in significant amounts of pain. So the good news is they retake my mom's blood and everything goes down. So what came out is 3 days in the hospital for one MRI to show that she passed the stone on her own. And the first story we got was, well, she still has a stone and she's going to need a stent. And that's the gastro unit. And then Dr. So-and-so is the other unit that will do the surgery. Those were two conflicting stories. Then 2 days later, she finally gets the MRI only to find out that it's another story and she's past the stone, but it's dilated so the duct is dilated, showing she had a stone and that now that she has stones, that now she's going to need the gallbladder out within 4 to 5 days. Then the next day, it turns into 4 to 6 weeks. You'll get surgery in 4 to 6.
Why so long?
Now, I agree with that because I know from my own little diverticulitis, you have to wait till inflammation goes down before you start poking and prodding.
But why such back and forth with information?
4 different stories. Now, your father was witness to that. We're just like, can somebody please tell us what the deal is? We get, it's like the left arm doesn't talk to the right arm, like legitimately. So finally, the last day was kind of like the cherry on top. They send in this poor guy nurse who is the guy that has to run everything through insurance and is like, okay, so Patty, so here's what we have. We need you to sign this form that's going to say that you went from inpatient care to observation. That way the insurance company won't fight you on it and it will just pass it through. So my mother looks up and goes, oh, why? Because you guys need to cover your ass, which that's exactly what it was.
Of course.
They admitted her. They didn't take care of her in time. She was technically only under observation because she didn't really need anything other than major antibiotics. And so then he leaves and the fire alarm goes off. And there's a fire in something near the gift shop.
Just to add a little more to your time.
So then they shut the doors, they lock us in, and it was the nicest little fire alarm. Ding, ding, ding. Ding, ding, ding. It's not like,
it wasn't like, evacuate.
No, not at all. I don't think they want to rile the cardiac patients.
Or that lady can you imagine that one woman?
Yeah. So that was kind of the experience. It was very frustrating. Very frustrating for the support person. Very frustrating for the patient. And the best part about it, I'll never forget this. They give my mother an anti-anxiety med to go down for her MRI because she's never had one. I told you this story already, but for our viewers. They give it to her and they wheel her down. This doesn't kick in at all.
While she's getting the MRI.
She is pumped full of adrenaline. They wheel her back up like an hour and 20 minutes later. She jumps off of the bed. She walks in like a Rocky scene and goes, I did it! And is now like pacing around the room. Because if you've met my mother has the most incredible amounts of energy.
Yes.
Ever. I don't know where she gets it from. And then all of a sudden she's standing there like 20 minutes later and we just see her eyes kind of go, oh. And we're like, you need to
lay down.
Lay down. Now it's time to lay down. And she
go nighty-night.
She went right. Yeah, she passed right the hell out. Took it almost 2 hours for that pill to kick in for her though. Advair or something. I don't know, whatever.
Isn't it supposed to kick in after like 20 minutes?
Yeah, not for her. You can't compete with my mother's adrenaline.
Yeah, so things are done and gone and she's ready to go home and now she's like knocked out.
Yeah.
Oh my gosh.
So I think the exacerbation of the issues in our healthcare system is, and here's what I'm going to tell you is, you think that you go in and you're going to get taken care of, but you don't understand. I think a light is being shined on is that I believe that the healthcare system is more a business than it's ever been.
Yeah.
And
they're all linked together with big pharma, the hospitals. It's all the government even. Like, it's hard not to view it that way, especially when so many people have these kind of experiences.
But it's like, this isn't for the patient.
No.
They're doing what's best for the hospital right now. One of the other things I noticed, which just blew me away, we got there at 8 p.m. at night. They had just pulled all of the trays from the food for dinner, and they were all in the middle of the ER, just stacks of food, eating food, and you can smell it. Hospital food, lovely smell.
Mm-hmm.
I got back. I was there till 8 the next day. I got back by 10:30. Still there.
The trays of food.
Still there. Never moved. Blech.
Yeah, throw up in my mouth.
In that wonderful hospital food,
In the
smell.
emergency, or were you in a room at this point?
No.
Or still the emergency room? Oh,
Still in the
lovely. Where
emergency
people
room.
are hacking up. No.
But it's just old, rotten, dirty food. Nobody rolled it away. Nobody took care of it. They just kept pushing it around.
No. Well, there's a shortage with, who takes care of those too.
The one nurse is trying to pull, I don't know, one of the machines they use, and there's a box of tissues on the floor. And he can't move it because the tissue box is in the way. He takes his foot.
Stop.
And kicks it to the side to get the machine out.
The tissues.
I looked at him, I go, I got it.
And those are the same tissues they're offering to patients.
Well, the cleaning lady came around and threw them away.
I hope so. My God.
I have pictures of this ER room. It looked like a bomb went off. And once again, the nurses are just standing around on a computer. Let me show you these pictures I have. It's disgusting. Next to me, right above my mother's bed is just like old Gatorade bottles, old water from the patient that was in the bed before her, whoever that was.
What?
They didn't clean the counter. On the counter for the girl with the UTI, which is probably like, I don't know, from me to Adam, there's vials of blood. Somebody's blood just sitting on the counter. Once again, that also sat there for about 6 to 8 hours.
You're lying.
In the printer that we were stationed next to, I read about 4 people's blood work and charts that nobody ever came to collect. I was like, oh, this person has a high white blood cell count. We should
there goes
find
Chrissy.
this
She's
person.
going to find them. She's treating them.
I'm like, his RBC is up too. Like, this is bad.
You're going to the nurse's station like, excuse me, this patient has this, and the treatment you're doing is incorrect.
I felt like saying there's this little law called HIPAA.
Well, just that little thing.
This is a little privacy law called HIPAA, and you're just leaving patient records.
But this is what's so concerning. That is concerning. I mean,
who is sitting in a room coming up with something better? Is anybody?
Obviously not.
I get you're short-staffed. And listen, the people you have are great, but you don't have enough of them. And I asked a nurse upstairs, one of the traveling nurses, I go, is anybody doing anything about being short-staffed? I said, is there any plan in place that you know about?
Right, because now we're in the year 2023. So what is the plan?
Because it's not going to happen this year. You need to start training nurses now to catch up in 5 to 10 years.
I was reading, I think it was a CNN article, actually. It was Texas, San Antonio. This mother was her 17-year-old daughter. She drove 45 minutes away from her local hospitals because they were filled. It was a gallbladder issue. So
I know all about the gallbladder.
Yes, I thought of you guys. She drove her 45 minutes away to a different hospital because everything else was at capacity. Her daughter needed her gallbladder removed, but because there were no available beds, her daughter has to wait at home on medication, missing school, staying in bed, and waiting to be seen, basically because she's not life-threatening.
Well, yeah.
And I understand, but you think about that as a parent.
Yes, it's not easy to sit there and watch people suffer that you love.
Especially a younger kid like that. It's just, but again, what is the plan? Because especially with children, right? So basically this whole past, starting in the fall, like when schools basically started back up, even still going on, it's a huge surge of respiratory illnesses.
Well, because we've sterilized everybody.
Right. It's like, and then people are like, oh my God, we've never seen it like this before.
Listen, we're learning right now that what we chose to do during COVID
has effects, has consequences,
major consequences. And once you have who was it that just wanted to bring masks back? One of the states,
Massachusetts.
They want to.
And there's talks about it here.
Why are we just repeating the same mistakes over and over? And are we really that inept to figure things out? Come up with something better.
Right. But now look what's happening. Beds are filled, and it's not with COVID. It's with respiratory problems, and they're in infants, in toddlers, in kids, my kids' ages.
Well, let's talk about what's happening in China. So the girls who do my nails, I broke a nail, because I was chewing on it in the emergency room. They're from China. Oh my God. They're like, I love these women. I would literally, I literally am like, let's go out for drinks. Like, let's go hang out. You guys are so awesome. Her name's Mandy. She came over from China. Her parents came over from China. Her mother's actually a doctor, believe it or not. They lifted all those restrictions just willy-nilly. It was like, fine, you people want this. And they didn't have anything in place to support if there would be an outbreak. Everybody in China has it, and it's really bad. If you see pictures of their emergency rooms, you can't even bring people in. They have people. We were in beds in a hallway.
Aren't they putting people in these like little
People
rooms?
are in chairs. They're in chairs in front of each other. Her grandmother isn't doing well, and they can't even bring her in because there's no room. Thank God her mother's a doctor and can administer her fluids. Yeah.
It's just really opened your eyes. And like you said, I think the pandemic really shed light on issues that were there. Like, again, I know I talked about the nursing homes. I think I was reading an article about the nursing homes, and that there had been issues that have always been around, especially with staffing.
Yes.
But I think when the pandemic hit, and obviously, especially in New York State, the horrendous...
Well, get a government injection or lose your job. Like, come on. Are we stupid?
And you lost thousands of people.
Come on. I mean, really, that's the best we could come up with? Yeah. An ultimatum?
Yep. And you probably, I mean, there was no room to lose anyone, like, especially in those fields. And you lost thousands of workers, good workers, that we are still in need of today. All because we had to jump the gun and do that to people.
Well, they hid information from us, which they should have never done. Once again, anything to do with medical and how you're going to take care of your body, you should be given all the information so that you can make the best decision for yourself.
100%.
Because you're the one that has to deal with the after effects. Not the government, not Kathy Hochul making...
Yeah, they're not living your life.
Exactly.
It's just...
How dare you hide information while people are trying to make decisions?
And it's not only that, it's that, but again, just the fact that people who were ill couldn't be with their loved one if they were admitted to the hospital or in a nursing home. They weren't allowed to see their loved one. I read an article, it was heartbreaking. It was from Newsweek, actually, about this woman who lost her mother, not even due to COVID, but she had to be admitted to the hospital during COVID because she had a lung disease. And she was not allowed to see her. She watched her die on FaceTime, and she was by herself. And you know how many people that had to go through that?
A lot. Too many.
That is not okay.
That's grandma.
Yeah. That makes me sick to think about.
Grandma was isolated too.
She was isolated.
Although our family poured in and almost got arrested for it.
They came.
They definitely got kicked out a couple times.
You weren't going to stop them from seeing their mom.
You shouldn't stop anyone from seeing their dying mother or father or a loved one.
It's just, and this woman was explaining how because of the shortages, the beds were filled with COVID patients at her normal their local hospitals. The mother was sent to a hospital they had never been to before with staff and doctors that they had never seen before. So she was trying, like the doctor her mom was assigned to, she was trying to text and call to get updates, and she would barely get updates on her own mother. And if she did, it was like one-word answers.
A text update. Oh my
Staff
God.
was getting irritated when she would call to try to FaceTime with her. Like the staff was short with her. Basically, like she was on FaceTime when her mom took her last breath. The nurse said on the FaceTime call that the beeping, the monitor was beeping, and she just said, the nurse was just like, yeah, that means her heart is stopping. She never heard from a single doctor after she died. I mean, and not only, so that's traumatic, right? Like that, I can't even bring myself to think about that. But then it's for the patient that had to go through that and unfortunately passed away of being alone and ill, and the probably poor care it sounds like she was receiving. But also it's going to be traumatic, probably lifelong issues now for the daughter who says she has like PTSD symptoms now because of that experience.
Yeah, there's a lifetime of regret.
Lifetime of regret and pain and anger. Like it has effects on the family members too. And for some reason we thought that was the protocol.
You want to know what the scariest thing about all of this is that nobody is trying to solve the problem right now, and nobody is coming up with what happens if this, what do we do when this happens again, because it's going to happen again.
It's going to happen again.
There's going to be a pandemic again, and nobody wants to sit here and be like, this is how we have to handle healthcare workers. This is how we have to handle patients.
And their families.
Nobody is coming up with that playbook, and it's pathetic.
It's pathetic. There was in that same article, a study in the American Journal of Respiratory and Critical Care Medicine found that following a loved one's stay in the ICU, and this was during, the pandemic, but 48% of family members, which I feel like is probably low, felt information was incomplete. Like they weren't getting all the information. They weren't there. They weren't there to help advocate for their loved one, answer questions. And especially if you're older, if you're elderly, right? You think they're going to be able to comprehend everything? Especially it depends on what level of critical care they're in.
No, I don't
think there's no one there helping ask the questions?
I thought she was telling me I had cancer. No.
Right. They're on all these medications. They don't have anyone asking the questions. They don't have anyone making sure they're comprehending what they're being told, the plan of action, nothing.
The only thing that advocates for you when you are in some type of health situation is your support person. I hope that this country never takes that away again. It's not okay.
It's not.
You have no idea what they're doing to your loved one behind closed doors. And I'm going to tell you right now, if I wasn't up every nurse's ass, if your dad wasn't involved, if those kids weren't involved when our grandmother, you don't know what's being done. And here's what I can tell you. Nothing gets done unless you stick your foot up their ass.
Right.
Nothing gets done unless you're like, where are the discharge?
You have to double check everything.
Everything. It doesn't get done. You just get forgotten.
It doesn't get done, or the right thing might not get done.
I am having a very good experience with my little thing going on. I have never had to go through this many things for a surgery.
That's good.
I have to meet with my primary. She has to clear me with something in an EKG. I have to meet with a preoperative team to do blood work and get questions answered and go through medications. I have to meet with my doctor the day before the procedure. I have to do a knee replacement exam. I have this little appy that gives me depression quizzes all the time. Do you feel hopeless today? I'm like, no, I feel fine today.
Today I actually feel okay.
Yeah, but take the knee out.
Don't ask me later.
It's been the most incredible, thorough experience I've ever. They used to just.
That's good.
They used to just throw you on the bed and say, count backwards from 100.
Let's hope your stay in the hospital is.
So I will follow up if it was the actual day of the event.
Yes, we need follow up, because I had great care with my back. Everything leading up to the surgery and the surgery itself, I had no issues. It was smooth. Everything was clear.
It's just when the hospital.
My surgeon was amazing.
Yeah.
Everything was great. It was just once they said, "Okay, the surgery's done. You're gonna recoup now." Well, I did not recoup. So
how long were you in the hospital?
Was it 2 days? I think?
2 days. Yeah. Okay.
I blacked it out, but I could not wait to get out of there.
Yeah, I'll be there for a day and a half. So
all right, so it's not too bad.
No, not too
just
bad.
Make sure they keep up on your pain.
But I got my little package in the mail, and it's got all. I'm very young for a knee replacement surgery, so all of their material, their marketing material, has all these old people on it. So I have this old lady on a bike.
They should put you on it. They should add you.
Someone else said that too. I'm like, I'm not going on. No, because I'm very rare. Very rare.
There might be another rare person that might be like, oh.
Even my doctor's like, I don't want to do this, but I go, you can't make me live like this. He goes, no, I can't. Yeah. He goes, you're right, I can't. But
the good news is because you're young, hopefully recovery
will be easier.
Will be that much, a little bit easier and quicker maybe.
I guess it takes 3 weeks for me just to get to a 90-degree angle. It's going to be weird. I'll get through it. Whatever. I have to. I have no choice.
Yeah, we'll make sure you got plenty of goodies.
I know. I do not have to be on a low-fat diet, which is nice. But they're like, you have to eat 100 grams of protein every day after surgery. I'm like, I don't eat 100 grams of protein in a week. Yeah, because it helps you heal or something like that. So, yeah.
Okay. Well.
All right. Well, thank you to all the doctors and nurses who are working.
Yes.
And we get you're working your butts off. I just wish your processes, somebody would help you with that. I really do.
There needs to be support from up above, wherever that comes from.
People need to rethink how to do more with less people, because it can be done and you can keep your sanity.
And we've all seen great care as well, and that really makes a difference. But if you don't have the capacity to do it.
Listen, every time I talk to a nurse, I say, thank you for your service. Every time I talk to a doctor, I kind of say the same thing. It's like, thank you for your service.
Yeah.
You guys do so much for us.
And they go through a lot, you know?
Mhm.
So
I bet. So that's what we have for you today. Yeah, next time we'll see ya. I don't know why I'm ending it like
next
this.
time.
Don't shoot the camera.
We'll see you when we see you.
All right, guys. We'll talk to you next time.
Bye.